Alright, so today I'm going to go over aspirin. So aspirin is a drug that was formed in the late 1800s, and even though it was made a long time ago, it still has relevance in today's modern time. It's still widely used as a pain reliever and also as an anti-inflammatory. Another effect that it has is as an antithrombotic. So, how does aspirin relate to some of the topics we've been going over in this module? Well, we've been going a lot over degradation pathways, synthesis pathways, and this topic in particular relates to lipid synthesis. How so? Well, we take a look at arachidonic acid. So this is formed from lipid synthesis, and this acts as a precursor to leukotrienes as well as prostaglandins. And leukotrienes are involved in cell signaling, and we'll be focusing more today on prostaglandins and how they are involved with inflammation as well as blood coagulation. So, how does aspirin have an effect then on this pathway? Well, that relates to cyclooxygenase. So cyclooxygenase, and there are two forms of this, COX-1 and COX-2, is also referred to as prostaglandin synthase, shown here. And just by looking at this diagram then, we kind of have an idea of what aspirin then does if we consider cyclooxygenase. So aspirin actually inhibits cyclooxygenase, and if it inhibits cyclooxygenase or prostaglandin synthase, it does not allow the conversion of arachidonic acid to form these prostaglandins here. So we'll talk about it a little bit later, but this has an effect on inflammation and thrombosis. So going back, how does aspirin then have an effect on cyclooxygenase? Well, this kind of goes to the structure of aspirin. So if we take a look at aspirin, we see that there's an acetyl group shown here. And what aspirin does is that it acetylates cyclooxygenase. So it transfers this acetyl group to the serine 530 on the polypeptide chain, depicted here and here for either of the cyclooxygenases. So it transfers that to the serine 530, and as a result, inactivates the enzyme irreversibly so that the arachidonic acid cannot feasibly enter the pocket of this enzyme and be transformed into the prostaglandins that we need for inflammation and thrombosis. So that gives you an idea of the mechanism of action of aspirin with respects to cyclooxygenase. Now, if we take a look at the pathway overall, we can begin to discuss then how does it have an effect on prostaglandins. So here we have a pathway of arachidonic acid converting and forming these prostaglandins. And as we had discussed, aspirin does block and inhibit the cyclooxygenase, so it's shown depicting here having effect on this pathway. In this case, it's preventing the formation of these prostaglandins. So what effect does this have then? What are prostaglandins important for? Well, prostaglandins are important, as I had mentioned, for inflammation and thrombosis. In particular, prostacyclin, for example, it is a platelet activator. It's involved with the coagulation cascade, but it's also a vasodilator. It dilates the blood vessels to increase blood flow. Thromboxane, shown here, is also involved with the coagulation cascade. It is involved with promoting platelet aggregation. So that, as well as vasoconstriction. So decreasing the vessel wall diameter. So it actually works kind of opposingly with prostacyclin, but overall it's trying to regulate blood flow in response to tissue damage. Tissue damage as well, resulting in inflammation, which prostaglandins are very important for. So tissue damage inducing these coagulation effects in order to prevent blood from leaking out, but also to prevent infection, which is why inflammation is occurring as white blood cells travel to the area that is affected. By flooding white blood cells into this area, we can prevent damage to the tissue. So all of this, the inflammation, people don't really like that. It's painful, obviously. So we can take aspirin in order to reduce some of that inflammation and to reduce some of that pain, in order to prevent some of the release of these prostaglandins, as aspirin works on cyclooxygenase. And in respects to blood clotting, for people who do have a potential risk for too much blood clotting, we can, in this respect, use it as a way to prevent thromboxane, aggregating platelets, to prevent this coagulation cascade to a certain extent, so that we can use it as an aid for that. So it's somewhat considered as a blood thinner in that regard.